Assalamu alaikum wa rahmatullahi wa barakatuh. Our beloved viewer, once again, welcome to your program, Health Check, a program where you bring medical experts to give us medical advice regarding certain ailments affecting our daily lives or health. With me today is a new gentleman on the program, that is none other than Dr. Abubakar Kange.
Thank you.
Most welcome to the MTA studios. Is coming for the very first time, discussing a topic of discussion today, which is diabetes mellitus. You'll correct me in case I pronounce it the bad way. Actually, that is the very reason you're here. What is diabetes mellitus? That is the reason why Dr. Kange Abubakar is here. We need to know much about what causes it, how to overcome it, how to live with it in case it's not among the diseases that are uncurable. That is what you're looking for out in this program. You're most welcome once again, Dr. Abubakar Kange.
Thank you, Bashir.
Straight to the point. What is diabetes mellitus?
Thank you, Bashir, for this opportunity. I'm happy to be here.
We are so humbled.
And before I even define what diabetes mellitus is,
yes,
I want to appreciate for being here and talk about this topic.
Okay.
Because if we are to look, diabetes is a major public health issue globally.
Yes.
And if we are to look at the statistics of the whole world, we find that diabetes is at 10.5% of the entire population. That means like out of every 100 people, you may find one person has diabetes.
Globally?
Globally. And that is around 537 million people living with diabetes in the entire world.
Wow.
That's a very big population. So I'm happy to talk about diabetes. Back to your question of what diabetes mellitus is. Diabetes, what we have to understand, one, it is a chronic condition. What it means to be chronic is that you are going to have for life, your entire life. It is not something you are going to treat and you get cured from it. So the reason why we treat is to avoid the complications which come with it, which we shall be looking at.
Okay.
So with diabetes mellitus is a chronic condition characterized by high levels of sugar in the body, which we call hyperglycemia.
Okay.
And it is either due to low insulin production, or if insulin is there, the body not using well that insulin.
What is the insulin and what does it do in the body?
Insulin is a substance which is produced. I always want to explain to our viewers to understand that inside our body is like a world of its own. Like the things you see happening in this outside world you look at, yeah, the same things happening almost
inside the body.
Yes, there is a similarity in them.
Okay.
So insulin is a substance there which is produced by the pancreas.
Okay.
And in the pancreas, we call it like a factory. You assume like a pancreas is like a factory there. Its role is to produce insulin. And that substance which is produced by the pancreas, which we call insulin, helps the body, the body cells, to take up that insulin, to take up that sugar or glucose.
The sugar that we consume.
That we consume into the body. And it is the glucose which these cells use to do the other activities in the body.
So in other words, the insulin helps to balance the sugar that we take into our bodies.
Exactly. The insulin, when it is there, it will help the cells to take up the sugar which is there. So if the sugar is not being taken up, it is going to become high and it will cause the problems.
Okay. It should not be very high and it should not be very low.
Yes, exactly. There is a normal range where it is supposed to be. If it is up, it is going to cause chaos. If it is low, it is going to cause chaos in the body.
Back now to the explanation of diabetes mellitus.
So back to so you find that the different types of diabetes come from that definition. Whether if insulin is not being produced, you will have, or it is low production, you will have the type 1, which they call type 1 diabetes. Okay. And when the insulin is there, but again the body is not using it, you will get the type 2 diabetes.
Okay. And now, due to these two types that you have explained, or you have mentioned, type 1 and type 2, what could be the difference between the two?
One, the first difference, obviously there are other types of diabetes, but for our discussion today we can look at those two, but there are other types of diabetes, like the gestational diabetes, those ones which pregnant women get while they are pregnant. There is the diabetes of the young children, but specifically from our definition, from what we can understand today, we look at these two types. The first type, the type 1, is due to insulin insufficiency. Insulin is being produced in little quantities, which means, and what is causing it is an autoimmune condition. What it means by autoimmune is like the body's immune system, the system which helps you to fight the diseases in the body, again attacks its own self. It's like being in a country where what is supposed to protect it, its security system, again starts destroying the embassies, the different offices in the body. It's what happens in that type 1 diabetes. So the body itself starts fighting its own cells, the beta cells which are producing insulin. So in the long run, the cells which are supposed to give us insulin are destroyed, and we shall have low to no production of insulin in the body. And what causes that, our current understanding in medicine, we do not fully understand the mechanism which is involved, but we know that your genetics can be responsible for that, the body attacking its own self, or even other environmental factors. You may contract a certain virus, or you may have some medications which can cause that, which are rare cases. So the mechanism for that one, we do not fully understand it yet as of now. So the other type is the type 2, and that one always, the type 1, is mostly it develops in the young children and the young adults. Okay. Whereas in type 2 diabetes, for it is always occurring in the adults, in the aged people. Okay. And for it, we always describe it as insulin resistance, because the body is producing the insulin. However, the body is not recognizing that there is insulin. So the sugars will end up accumulating in the body. And for it is always happening in the adult, like what I said. And for it, it's symptoms. They take time to happen, and it is related mostly to lifestyle changes, like maybe when you have you have obesity, or you are inactive, you in that state of being inactivity of not doing.
Talking about symptoms, like you said, what are the common symptoms of diabetes?
The common symptoms of diabetes we always look at. One, in our settings, for example, what you may not miss out, what you don't miss out. One, in our science term, we call it polyuria, which is in the lay language, which is increased urination. Okay. A person can come to you and says that I wake up in the night over 10 times urinating. As soon as I go to the bathroom, again I'm there, like you urinate a lot. Secondly, you may have increased thirst. A mother may come to you and says, my son almost has to walk with a bottle of water everywhere. Every time he's feeling thirsty. And also the other symptoms we may have, they may be related to the complications that you might be getting of diabetes. For example, you may have blood vision, you're not seeing well, you may always be feeling weak, There are many symptoms we can always
Okay.
look at. And also, when you get the wounds, they also take long to heal. So when someone comes with those
A
symptoms,
simple cut and it takes time to heal.
Yes, and you wonder why you are not healing very well. Yeah.
Okay.
Yeah. Basically, those are the few symptoms I can talk about.
Okay.
And like what I said, in type 1 diabetes, always the symptoms are occurring very fast. While in type 2 diabetes, we see that they take time, they develop gradually.
Okay. Thank you so much, Dr. Kange Abubakar. Now this takes me to the diagnosis issue. How do you diagnose diabetes?
Thank you. With diabetes, you know, diabetes is not a new disease. It has been here for years. For example, even the name itself is driven from a Greek word and a Latin word, the diabetes, which means to siphon, to like to pass through, and the Latin word Mellitus, which means sweet. So in the ancient times, because the first person from our records who understand who first described the diabetes mellitus was Apollonius of Memphis. That was way back even before Jesus Christ came. And that is about 250 years ago, BC, before the coming of Christ. So for them, the best way they used to know that someone was diabetic, someone could urinate there, and when insects came to check, because there was sugars in those that urine, sugars are being passed out through the urine, so the insects could come to eat the urine or the sugar samples which are in the urine. But we have moved away from that. Our science has really developed. And the current
insects of nowadays are not ashamed. They are more hungry than we, the human beings.
Exactly.
They can feed on anything.
Anything, yes. And you see that even when you put there, a simple experiment is when you put there sugar, you will see that the insects will come and pick it.
Okay.
So that's what in the past they relied on. But our science has really developed. Currently, depending on the settings where you are, but majorly we can look at majorly 4 or 3 ways we can confirm that someone has diabetes. One, someone may come with those symptoms I mentioned about, and we can choose to do a random blood sugar there and then, and we look at it and say, oh, with these symptoms and these sugar ranges, because we have a scale, we look at that this is the normal range, this is the pre-diabetes, and this is diabetes. So we can do that test. Or we can, the most commonly 3 done in our settings, we can do a fasting blood sugar. We can tell someone to fast for at least 8 hours, and they are not taking in any meal, and we take off a blood sample, and we look at the sugar ranges at that time.
Okay.
And of course, like how I said, we have a scale we look at. So there are ranges we look at, that from here up to here, this is normal. From here up to here is the pre-diabetes, and from here up to here, it is a diabetic range.
Okay.
And we can use that to diagnose. Thirdly, we can also look at the OGTT, that is the oral glucose tolerance test. For it, what differentiates it from the fasting blood sugar is that after you have fasted for about maybe 8 hours and you have taken off a sample, we shall again give you a solution which contains glucose. And later on, after about 2 hours, we take off another sample from you and we look at the values of your blood sugars. So that one, we can also do that. Another one, which is like a gold standard, is the one which is called the HbA1c. That one is looking at the sugar levels, how they weigh. It is looking at the glycolated hemoglobin. The hemoglobin, how much sugars were they, about 2 to 3 months ago. So that one gives us a good picture.
Okay.
And we can use those ones to diagnose the diabetes depending on the ranges. Because like that one, if we look at someone who has a percentage of glycated hemoglobin, which is above 6.5%, we can say this one has diabetes.
Okay. Thank you so much, Dr. Abubakar Kang. This now takes me to the management process. In the very beginning, you said that this is a chronic disease, meaning
Exactly.
once you're diagnosed with it, you are to live with it forever.
Exactly.
How are you going to manage this disease once you're diagnosed with it? How do we live with it?
One, how to live with diabetes. If you have gone to your healthcare providers and you have confirmed that indeed you have diabetes, we prefer to always individualize the treatment for diabetes. And there are many things we do. One, the management of diabetes mellitus, what you have to understand is it is multifaceted. It's like it is broad, that you are not going to only be on one thing. One, what I mean, for example, we shall have to look at lifestyle modification. And in lifestyle modification, we shall look at things like diet, we look at physical activities, and we also tell you about this. We have diet, physical, yes, and tell you to lose weight. And if in case of those ones who smoke, we shall tell you to stop smoking because of those ones affect. Then we also have medications we use. Those ones can be, those ones tablets you can swallow. We also have insulin specifically for type 1 diabetes, because the challenge is always the lack of insulin. So we supplement you with, we give you insulin, or in some cases of complicated cases of type 2 diabetes, we shall have to also give you insulin. And the other things are about monitoring sugars. So like what I said, the management is multifaceted. We do many things, and we always attend to each individual as a person.
Okay. About the lifestyle changing, you talked about the diet among the management, how someone can manage. You talked about changing the lifestyle, and we spoke of the diet. What diet do you recommend for someone that is diagnosed with diabetes?
We always prefer that, since I say that in the management of diabetes mellitus, that each person should have an individualized or a personalized treatment management plan. So we prefer that each person should work around with their dietitian, so that they are advised on which foods they should eat and what. But just broadly, we always encourage to, because our challenge is the sugars. So what we do, we have to do meals, to consume meals which do not give us a lot of sugars in the body. We have to encourage people to eat a lot of fruit. We have to eat a lot of vegetables. We have to eat lean proteins, and also reduce on the saturated fat, the fats which we eat.
Okay. Talking about diet, you can't mention about diet and you forget mentioning about exercise. How does it help in managing diabetes mellitus?
How I explained that in most cases, the type 2 diabetes is related, or the reason why it comes, it is related to lifestyle. So activity helps. For example, if we look at moderate to intense physical exercise of about 150 minutes per week, that's 2.5 hours, we look that it will, one, it is going to improve your health, your general well-being. Secondly, it will also improve the insulin sensitivity, because in the start I said that insulin is there in the body, but the body is resistant to it. It's not recognizing it. So when you do a lot of exercise, it will improve the body's sensitivity to insulin. Secondly, when you do exercise, it will help you to reduce the body weight.
Okay.
Yes, and yeah, you will live a healthy life. So basically, exercise is doing basically those ones.
Okay. There are some people that are not disciplined when it comes to taking medical advice from their doctors. What complications can one face in case he fails to manage diabetes as prescribed by the doctor?
What I want to let our viewers understand is that if you do not manage diabetes well, if you not seek out help from your health care providers, it is going to be chaos. What I mean, diabetes affects almost the entire body organ. I will give you an example, almost from each system. If we are to look at the cardiovascular system, the system which is responsible for pumping blood in the body, the heart and the blood vessels, when that excess sugar is in the blood vessels, it is going to cause this kind of chaos. Imagine, for example, there is a road and what is supposed to pass there is food, and different services to different destinations. But that road where it is supposed to pass, you find there many things, potholes, things dumped there, because it's what happens. This glucose is going to get deposited in the blood vessels, so the transport system is going to be disorganized. And also, since you will find that the body has been made aware in that if there is a problem, it will try to intervene. Now imagine a pothole has been put in a road. You who is coming to go straight to the other side, you are going to be delayed because you are going to find their workers trying to clear away the road.
Yes.
So it will lead to many cardiovascular complications, including you can actually, in the worst cases, get even stroke because of that. These sugars will get deposited in the small brain, blood vessels in the brain, and when the vessels are blocked, it means the supply is cut off, and you will get the stroke. Okay. Also, another system I can look at, you look at the kidneys themselves. The kidneys' role is responsible to filter the body of toxins. But when there is increased sugars in the body, that means their work of the other filter in the kidney is going to be overworked, and it will end up growing large. Secondly, we shall see that even these sugars which are passing through are going to destroy it. And in the end, you will see that even the important molecules in the body, like the proteins, are going to end up being burst out through the kidneys. Okay. And in most cases, you find that the challenges you will have your kidneys will fail to work. Okay. Secondly, you will also have challenges with your eyes. You will not see very well, because when these sugars also get deposited in the small vessels which are supplying the eyes, they are going to affect them. There is also another substance which when the body sees that the glucose is too much in the body, it will try to convert this sugar into other substances like sorbitol, which will affect still the eyes. Another thing we can look at is your wounds. In case you get a wound, it will take long to heal. One, because blood reaching there to take the nutrients and the body's soldiers to help fight off that infection. The roads, I told you, they are destroyed. That means even the nutrients which are supposed to be taken to that site to clear it, they will take long to reach there. Something which would have taken seconds is taking weeks to reach there. Okay. Even the medications you are taking, it will be hard to reach there.
Thank you so much, Dr. Abubakar Kange. Unfortunately, time is up, and we cannot go beyond this, but I can't let this pass you just need to give advice in a few seconds to the newly diagnosed member or patient with diabetes.
The advice we can give to the newly diagnosed members with the diabetes is that one, when you understand that you have been diagnosed with diabetes, you have to be proactive and stay informed about your own health. And also, you should closely follow up your healthcare providers so that they follow up with your glucose, and they also tell you a treatment plan. And they should remember that diabetes management is a journey, and with the right support, you can lead a healthy and fulfilling life.
Thank you so much, Dr. Abubakar Kange. Unfortunately, this is the time to say bye-bye. Till we meet next time, Assalamu alaikum wa rahmatullahi wa barakatuh.